Welcome to this NMC OSCE video. My name is Hannah and I am an experienced UK registered nurse of 20 years, a UK university lecturer of nearly 7 years, and have been a NMC OSCE programme lead. And I am sharing with you my kind of advice and help and tips really to practice and study for your NMC OSCE at home by yourself. It's obviously a really difficult exam with a lot of content that you have to learn, and I'm hoping these videos will provide you with a clear guide and a way to break your stations down and hopefully remember them and be able to pass your OSCE first time. I also offer tutoring, so small groups or one-to-one, get really personalised OSCE support and training for you, lots of feedback, lots of opportunities to practice and get feedback, which is really the key to success to practicing your OSCE, and those details at the end of the video. Okay, so today I'm going to be looking at wound assessment and aseptic non-touch technique. Put these two stations together because in the test centre they combine these two stations into a one long 21-minute skills station. Okay, so that's why I put them together. So it's a little bit of a longer video, okay, but that's because there's quite a lot to cover, especially with the aseptic non-touch technique. Okay, lots of components to that, so stick with it. Okay, and unfortunately not everything can be done in a really super quick like TikTok style video. Okay, we need to be really clear on all the detail with this station. Okay, right then, so wound assessment and ANTT. So like I said, this is a combined clinical skills station, okay, where you will complete the wound assessment and then go on to do your aseptic non-touch technique dressing change. Okay, so they combine the two stations into a 21-minute station, and roughly you want to be doing 6 minutes for your wound assessment and then your 15 minutes for your ANTT. Okay, and it's important to try and divide the time that way so you've got enough time left to do your ANTT. Okay, also if you fail any part of this station on your first attempt, say you failed the ANTT but passed the wound assessment, you would just go back and do the ANTT and you would be given 15 minutes to do that. Okay, so those are the timings. So what equipment will you have? So you will have your disinfectant wipes in order to clean your dressing trolley. You'll have hand gel, which you need to take with you on the dressing trolley. It's a little bit different to your other clinical skills stations where the hand gel is kind of just there. You'll need your sterile wound care pack. You'll need your sodium chloride sachet to clean your wound. You'll need your chlorhexidine wipes to clean the end of that sodium chloride sachet before you open it. Okay, and you'll need to select a sterile dressing which will be big enough to cover the wound that you have got on your mannequin. Okay, and in terms of paperwork, you'll have a scenario, okay, and you will most probably have a picture of a wound to assess for your wound assessment station, or you might have a simulated like plastic type wound as well. So that is what you'll be doing your wound assessment on. So a good tip is to Google lots of different pictures of wounds and practice doing the wound assessment to those. Okay, so you might have a scenario, again, could be a surgical wound, could be a medical wound, and you've been asked to review the wound and do a dressing change. Okay, and again, you've got your 21 minutes to complete both steps. So you might get a wound picture, okay, or like I said, you might get a simulated fake wound to do your assessment on. Okay, so how would I break this station down? So I'd do my key principles, okay, like with every station, then would go about doing my wound assessment, okay, and then I would finish that part, and then I'd clean my trolley. Okay, then I'm going to go and collect and check all my equipment for my ANTT. Okay, then I'm going to open up and prepare my sterile field and all my wound dressing equipment. Then I'm going to carry out my ANTT procedure. Then I'm going to dispose of my waste, and like with all our stations, just check my patient's comfortable and end the station professionally. Okay, so 8 key parts. So again, starting with those key principles. So very quickly, safety, make sure privacy and dignity, because you can be exposing a wound, and decontaminating our hands using the World Health Organization 7 steps. Okay, There's a huge amount of hand hygiene steps in this whole station, okay? And so I've highlighted them in purple throughout now, so you can identify those, okay? I'm going to do my ID check and allergy checks, okay? Unless it says on the scenario that those have already been done. I'm going to introduce myself to the patient and explain that I've come here to assess their wound and then carry out a dressing change, okay, and gain their consent. Now, with your wound assessment, it is absolutely essential that you check the patient is comfortable and complete a pain assessment, okay? So 0 to 10 pain assessment, okay, before you start your wound assessment procedure, okay? That's really important, and it's the #1 part on the marking criteria for the wound assessment, and it often gets forgotten and is a critical fail, okay? So again, so check your patient's comfortable like we do with all our stations. I teach that for all of the stations anyway, and complete that pain assessment. Okay, so then you're going to go on to your wound assessment, okay? So very simply, as it is laid out into marking criteria, you're going to verbalise the different parts of the wound assessment, which the NMC want you to do, and describe the picture of the wound or the fake wound that you have been given, okay? So first, you're going to examine for erythema. So these are key things you need to say, okay? So I'm going to examine for erythema. So you're looking for any redness or inflammation, and if you see that in your wound picture, you're going to verbalise that, okay? Next, you're going to describe the area around the wound, okay? So is it red? Is it pink? Is there any swelling? Is there any inflammation? Any discoloration? So whatever you see around the wound, okay, you want to describe that area. Next, you need to describe any exudate, okay? So can you see any exudate? Is it wet? Is it oozing? Or has it dried? Is there some like dried, like old exudate? Okay, what colour is it? Is it yellow? Is it brown? Or is it clear, serous, or maybe blood stained? Okay, so you need to describe the exudate. Then you need to describe the closure. Okay, so is this wound just an open wound? Are there any stitches or clips? How many are there? So count the stitches and clips if they're there, and note if you see if there's any missing or any that have been partially removed, okay? You need to verbalise all of that. The next thing you're going to describe is the floor of the wound. And traditionally, like I would always call that the wound bed, okay? But the NMC uses the term wound floor, okay? So again, looking at the floor of the wound, is it pink, you know, and epithelializing, or is it red and granulating? Is there yellow slough? Is there any black necrotic tissue? So you want to verbalise the floor, the wound bed. And then you need to ask your patient if they've got any tenderness, okay? So ask the patient if they've got any pain, and, you know, is it tender to palpate the surrounding area? You're not actually going to touch the actual wound bed, but is there any pain or tenderness? Once you've verbalised all of that, you need to describe any further actions that you should take. So, for example, if the wound has demonstrated signs of infections, maybe inflammation, pain, exudate, then you would verbalise about taking a wound swab and sending this to microbiology. And you'd also want to refer the medical or surgical team. The same may be if there's any sutures or clips missing, you'd want to escalate and refer that. Okay, so that's your wound assessment part of the station done. I would decontaminate my hands and finish that part of my station. I'm going to move on to preparing for my ANTT. Okay, so the first thing I need to do is to clean my trolley. So again, I'm going to decontaminate my hands. I'm going to put on my glove and my apron, and I'm going to clean the trolley from top to bottom. Okay, so get your chlorhexidine wipe. You're going to clean the top tray, and you'll want to go in a motion like this. Okay, you don't want to just clean it randomly like that. You want to go in a really systematic down, across, down, across, down, across, down, across. Then I'm going to clean my 4 legs of my trolley, turning the trolley with my cloth and cleaning my 4 legs. And then I must clean that bottom shelf as well. Once I've cleaned my trolley, I'm going to remove my gloves and apron and decontaminate my hands again. Okay, I've just cleaned the dirty trolley, so I'm going to want to decontaminate my hands before I go and get my sterile dressing pack. So clean your trolley, and then you're going to go and collect and check your ANTT equipment. So you need to get your equipment, and you need to put it onto the bottom shelf of your trolley. Okay, really important. Don't put it on the top shelf. It'll be a critical fail. Okay, so what equipment do you need to get? You need to get your wound dressing pack. You need to get your alcohol swab, your normal saline sachet, a dressing which is large enough to cover the wound, and your alcohol gel. With all your equipment, okay, you need to verbalise that the packaging is intact, sterile, okay, and the expiry date, okay. And that's really important with this station, because it's important that that sterile field has not been broken on that equipment. You need an apron. Put everything on the bottom trolley and take your trolley to the patient's bedside, just verbalising that you will disturb the curtains as little as possible. Once you're back at the bedside, you need to decontaminate your hands again here. Really important, okay? Put on your apron and open the outer packaging of your dressing pack, okay? Making sure you're not touching the inside of the dressing pack, okay? And slide the contents onto the top shelf, again, without touching the silver tray with your hands or the outside of the packaging, and without touching the dressing pack. Now, this is a crucial step here, is to do another hand decontamination before you open up that sterile field, okay? Often gets forgotten, so really important you do a second hand hygiene here. And then you're going to really carefully and slowly open up your dressing pack by touching the corners on the outside, okay? You must not at any point touch the inside of that sterile field, otherwise you're going to break your sterile field. You're going to have to start again. So open it up from the corners by pinching the outside and pulling it open, and just take your time. Sometimes they can be a bit tricky to open. Once you've done that, you're going to take the corner of your clinical waste bag, okay? So you're going to put your hand into the sterile dressing pack, being careful not to touch anything else, and grab the very top of your orange or yellow clinical waste bag. Place your hand inside the bag, again making sure you don't touch your apron or you don't touch any of your surroundings, and then use this bag to carefully pick up the items in your sterile field and place them out so you can get to your tray, so you can get to your gloves. Just be really careful that you're not touching the outside of this bag with your hand or touching it on anything outside that sterile field. Use it like a pincer, and nice and high, and move your bits around so you can open the rest of your stuff into your sterile field and get your saline into the galley pot. Because when you open the packet, everything's kind of stacked up. And then attach the bag, okay, to the side of your sterile trolley. So I'm just showing you here. So I'm just pinching the very, very top bit of that bag. Don't pinch it anywhere else, because you can then not put that into your sterile field, okay? Then I'm going to put my hand in there. And what I've done is I've just moved my gloves out so I can get to them. I've moved my gauze out so I can put my sterile saline into the pot, okay? So just place your items out. Again, making sure that none of them come out of side of that sterile dressing towel. Then I need to open up the rest of my equipment, okay? So before I put my gloves on, I'm going to open my dressing, okay? Again, using that non-touch technique, and gently tip that onto my sterile dressing field, okay? Make sure you don't put it on top of your gloves. You won't be able to get your gloves then without contaminating the dressing. I'm going to get my sachet of water and my chlorhexidine wipe, my sachet of saline, sorry, my chlorhexidine wipe, and I'm going to clean that for 30 seconds on the end. Just tear it slightly and then allow that to dry. So tear it with your hand over the chlorhexidine wipe and allow that to dry for 30 seconds. And then you're going to tip that saline into the galley pot in your dressing pack. Now, before you do anything else, just do a double look on the bottom of your silver trolley and make sure you've done that, okay? Make sure all your equipment is on your dressing field, okay? Your dressing pack and your saline. You shouldn't need any extra gauze or anything like that. There will be enough gauze in your dressing pack. Before you put your sterile gloves on, make sure you are close enough to the patient or your simulated wound so you can dress it correctly, you can reach it, okay? Make sure any bed covers are pulled down. And then when you're ready to go, decontaminate your hands again here, really important before you put on your sterile gloves. And then you're going to pick up your sterile gloves and you're going to pick them up by the cuff. So this is folded over. I'm going to touch the cuff and I'm going to really carefully put my hand into my sterile glove without touching any of the outside. So I'm just going to use this cuff here, okay, and pull that over. Then I'm going to get my next sterile glove. Again, I'm going to pick it up by the cuff. And what I need to make sure is my gloved hand does not touch the skin on my other hand at any point during this, okay? Otherwise, you're going to have decontaminated your sterile field and it'll be a critical fail. So again, take your time, because when you rush this stage, it's when you make mistakes and you break your sterile field, okay? So I can touch the outside of this glove with my sterile glove now. So the second one's a bit easier to put in. And I'm going to hook my fingers in, touching the outside of this one, and have my 2 gloves on, like so. Take your time. If you contaminate your sterile gloves, you'll need to start again. Then I'm going to carry out my ANTT procedure. Okay, so in your sterile dressing pack, you will have a sterile drape. So again, pick this up gently by the corners and place this underneath or the bottom of the wound. And when you're doing that, make sure your gloves are not touching the patient's skin, they're not touching the bedclothes, okay? They literally just corners of your sterile drape and putting that gently under the patient's wound. You then need to say to the examiner which hand's going to be your clean hand, and your clean hand is the one that's going to go into your sterile field and get your gauze, and then which hand's going to be your dirty hand, okay? And your dirty hand is the one which is going to actually touch the wound and clean the wound. So that is a really important key verbalization, but it's also really important that you follow that clean hand, dirty hand, okay? And don't get yourself confused, okay? So I would take my clean hand, okay, and into my sterile field and get my gauze. I'm going to dip that into my saline, okay? And I'm going to pass that over to my dirty hand without touching my clean hand. And then my dirty hand, I'm going to do one single wipe of the wound, and that is going straight into my bin, my little clinical waste bag that I've stuck to the side. I'm not going to pass that back to my clean hand. It's going to go straight into the bin. Then I'm going to get my clean hand again. I'm going to get another piece of gauze, okay? Dip that into my saline, pass it over without touching and clean. I haven't got a bit of gauze, this is a surgery pad, but you can see what I mean, okay? Really, you want to do 2 wipes of the wet gauze, and then use your other 2 pieces of gauze to dry the wound. And the same thing, pick up your gauze, over onto your dirty hand, 1 dry and away, okay? And then a second one, pick it up into your dirty hand, 1 dry and into the clinical waste. Make sure you have dried it well, otherwise your dressing won't stick and they can fail you for that. Then you're going to get your dressing, okay? Remember to put your clean hand into your sterile field and pick up the dressing with your clean hand. You're going to peel back the backing and make sure you don't touch the part of the dressing that's going to be directly in contact with the wound, so that key part, okay? So open up and apply that with a non-touch technique. Okay, so once you've done all that, you can pick up and remove your sterile drape, okay? Your sterile procedure is finished now, so you don't need to worry about which hand is touching what. So remove your sterile drape, make sure you place the bed covers back, dispose of all your waste, take off your gloves and your apron, and roll up all your dressing pack and put it all in the orange clinical waste, and decontaminate your hands, okay, after you have done that. And then just to finish off, then just check your patient is comfortable, doesn't need anything, and again that they've got the call bell and know how to use it. So my top tips for the station. So firstly, I try and think about it as 3 separate stations really. So station 1 is my wound assessment. Station 2 is cleaning my trolley and getting my equipment out and ready. And then station 3 is doing my ANTT procedure, okay? So with your wound assessment, make sure you verbalise all parts of the wound assessment as they are in the marking criteria. And don't forget to do that pain assessment right at the very beginning, and make sure your patient isn't in any pain. Verbalise your further actions from your wound assessment, so swab, potential referral to medical or surgical team, okay? Don't forget to clean your trolley, so top to bottom. Don't forget to put all your ANTT equipment on the bottom shelf of your trolley. Open your equipment really carefully. I know when you're nervous and you're worried about time, but do it really carefully, and don't contaminate your sterile field, okay? Really important. before you think about putting your sterile gloves on out of your dressing pack, just check the bottom of your sterile trolley and make sure you haven't forgotten to put your saline on or your dressing. Okay, that can sometimes happen just with nerves, really. So do that second little check down below. Take your time to put on your sterile gloves. Now you can get separate sterile gloves if the ones in the pack are too small for you and difficult to get on. So collect that with your equipment. Just make sure when you're opening those gloves that you either open them up. They come in a paper in a sterile towel or packaging. Make sure you're opening that up, and when you open that up, you're not contaminating the sterile field with your hands. So open them up to the side, okay, because they come self-contained in their own sterile packaging. Don't forget to verbalise your clean hand and your dirty hand to the examiner, and do not touch your clean hand with your dirty hand, okay? So keep them separate, and really think about and remember about all your required hand hygiene. Okay, there's lots of hand hygiene points in this station which are really crucial. Okay, I hope you find that helpful, because I had a request for ANTT. It's quite a big station, so a little bit of a longer video. Again, pause it, work through it. You can buy the sterile dressing packs quite cheaply online, so from a company called MediSave. You can get for $9.99. They're not exactly the same as the hospital grade ones, but they're absolutely fine for practicing. Okay, and I really recommend getting those and practicing that at home as well. And again, there's all my details if you want any further OSCE support or training.